a welcome to tonight's lecture entitled Italy at the Epicenter, Lombardy and COVID 2020 by Frank Snowden. Since there are people here I don't recognize, I don't know, I'm Marla Stone, currently the Mellon Professor at the American Academy. It's been a pleasure to have Frank and Jan with us these past months, and we've already learned a lot from Frank in conversations and wonderful after-dinner drinks, and I'm so pleased that Frank has offered to share his research and his new project with us today. Frank is a leader and a groundbreaker in a number of historical fields, from the history of medicine to modern Italian history. Frank is the Andrew Downey Orrick Professor of History at Yale, Emeritus, and served as the chair of the program of History of Science and History of Medicine for 8 years, and he also held the appointment as Professor of History of Medicine at the Yale School of Medicine. Frank served as a trustee of the American Academy for 12 years, as well as being with us as a resident. He has served as an interpreter. Frank Snowden has worn many hats in his illustrious career, has served as an interpreter for the U.S. Department of State, as a member of the World Health Organization's think tank on pandemic preparedness, and as a consultant for the World Health Organization on a program called Preparedness for Pathogen X. He earned his BA in government at Harvard and a DPhil in politics as a Marshall Scholar at Oxford. And among Professor Snowden's many, many publications, many award-winning publications, let me say, are Violence and Great Estates in the South of Italy, The Fascist Revolution in Tuscany, 1919 to 1922, which had profoundly shaped my own work, and has really shaped the work of many of us in fascist studies. He's also the author of Naples in the Time of Cholera, 1884 to 1911, The Conquest of Malaria, Italy, 1900 to 1962, Epidemics and Society, From the Black Death to the Present. The Conquest of Malaria received the Moraro Prize as Best Work in Italian History by the American Historical Association, and the Gustav Reines Prize by the Macmillan Center at Yale as the best work by a Yale faculty member, as well as the Welsh Medal from the American Association of the History of Medicine. Epidemics and Society has been translated into 9 languages and was selected by The Guardian as the best historical work and by the International Economic Forum as the best work for understanding COVID. And he's currently completing a book for Yale University Press entitled The Pathologies of Globalization, the Spanish Influenza, and COVID-19, which we're going to hear part of the research on that today. So a big welcome and a big thank you to Professor Frank Snowden.
Well, thank you, Marla, for that incredibly generous introduction, and I don't recognize myself. So in any case, I'm delighted to be here and to be able to talk to you about something that I'm working on and thinking about, which is COVID-19, and it's what can we learn from it. As part of that thinking process, I'm delighted to talk to you about a particular piece of that, which was the moment when Italy was the center of the world pandemic. And so that's what I'm going to be talking about. Because there's a puzzle in the very beginning. After there was an outbreak of an unknown but highly infectious disease at Wuhan in December of 2019, the world was stunned when it burst out in Lombardy, which became its second epicenter in February of 2020. The surprise was on many dimensions. The first was that it was very far away. And so people in the north of Italy and around the world thought, well, it's a 12-hour flight from Lombardy to Wuhan, and it's also some 5,800 miles away. So it seemed as though it was reassuringly distant. It was also true that in terms of the Southern question, looking at it from an Italian perspective, the Southern question in Italian history had always seen that the South was disadvantaged in terms of economic development, in terms of healthcare, in terms of literacy, employment, and also in terms of infectious diseases. For example, the South was the heartland for cholera, typhoid, malaria. And if we look at our map then of Italy and its 20 regions, it was very surprising, Lombardy with its 11 provinces, that it would be this particular region that was stricken. And I'll be talking as we go along, I hope. Well, this may not go along, but anyway, that was supposed to advance. If it does, we'll say that there are 3 provinces in Lombardy that I want to be talking about. One is Milan, the other is Bergamo and Brescia. So either we'll have them or we won't. It's not the end of the world. What I wanted to say also about the different regions was that Lombardy was very surprising as the place where COVID broke out. Surprising because it had the highest GDP per capita in Italy. It was Italy's wealthiest region, and it was among the most wealthy places on earth. It also was Italy's industrial, commercial, and cultural center. Its healthcare and educational systems were equal to the best in Europe. Its hospitals, like the Sacco in Milan and the John XXIII in Bergamo, were world-class and admired everywhere. The Lombard journalist Massimo Tedeschi raised the pertinent question when he asked, "Why here? Why did the coronavirus explode in our modern, efficient, German-like," he said, Lombardy? Whether you think of Lombardy as German-like or not, I'll leave to you. In any case, our challenge this evening is to answer, or try to answer, Tedeschi's poignant question. So what I want to do is to concentrate on the origins of the epidemic. I'm perhaps going to disappoint you, but I'll say it right out front. I'm not going to explore its course and the various waves, as I think those are now pretty well in everyone's mind, and I think it's important to look at how it came about. That's really the question that I want to be talking about. So first thing, though, I think we need to recall that the disaster in Lombardy was highly consequential. One way of looking at it is the official figures, as we see them, for hospitalizations. You can see the sudden surge, February, March, April, and then the end of the first wave. The deaths also, you can see the surge. And very unreassuringly, I have to say, said that this was based on officially confirmed cases, and the reason for that is that these are very serious understatements of what actually happened during the course of the epidemic, systematically understated. So we'll bear that in mind, and the next slide, if that cooperates, yes. This is more realistic because this is the excess deaths by week from 1911 on, and what you see is really this extraordinary spike in death, which is the black line that goes up, well, almost to the ceiling, and that's the spike that I want to be talking about today. Excess deaths show much more dramatically than the state's official figures because the deaths you can't hide, but hospitalization and official deaths you actually can. So that's another important feature. There was also a reason that this was trauma that was extremely concentrated and therefore greater, because mortality was concentrated in just a few short weeks. In March and April, this huge amount of death in this one region. Lombardy was also important because this was the portal to the rest of Italy, but more broadly, it was also the portal to all of Europe, or Western Europe at least. It was after Italy and by people infected in Italy that you get the spread of the disease to other Western European countries. It was also significant because one of the shockers was an existential shock that reverberated around the world. There was the sudden realization of the vulnerability of the whole modern industrial world that had considered itself safe from pandemic diseases. Let me just give you an idea of the kind of shock. This is outside a crematorium, and it is the coffins waiting to be buried, or rather cremated, because the crematorium couldn't handle the load of patients that it was required. And still more dramatically, is this of Bergamo, and this is Bergamo at night with the Italian military sending a convoy of trucks by night so as not to alarm people, but they're taking the bodies of the deaths in Bergamo and taking them to other places, predominantly Bologna and Mantova, as places to have them cremated and buried. And so it really is almost like reading one of the plague descriptions. There weren't enough people left to bury the dead. And anyway, this became true in Bergamo in this time. So let's go back to our question. Why did this happen, and why did it happen in Lombardy? I hold a view that you may or may not share. I don't think that epidemics are random events. Societies of different stages of their development experience different classes of pathogens as a result of pathways that they themselves create. In a sense, one of the fascinations of epidemic diseases is that they hold up a sort of mirror in which we see our own reflection, our own economic, social, and moral priorities. Let me illustrate with two examples. One is a contrast, and this is an early era of the long 19th century, the period, that is, of industrial takeoff and development between about 1750 and World War I. Major features of that era, relative to public health, were rampant, unplanned, chaotic urbanization, low wages, deficient diets and urbanization, deficient diets, omnipresent filth, unprotected water supplies. And it's not by chance that repeated outbreaks of diseases transmitted by the oral fecal route. Typhoid and cholera would be cholera particularly important because it was the most feared disease of this long 19th century in Europe. But now, in our time of highly developed industrial capitalism and mature globalization in the West, at least, since World War II, cholera has largely been banished as a threat in the industrial world. We're protected by the sanitary revolution of sewers, paved streets, refuse disposal, markets, housing regulations, daily rituals of personal hygiene. And for a time after World War II, and lasting for generations, and even in the medical profession, and even surviving today in popular imagination and the wishful thinking of many politicians around the world, there is the view that not just certain diseases have been relegated to history in the global north, like cholera. Rather, the view was rampant that all communicable diseases would soon be eradicated one by one, that the earth would become once again a Garden of Eden. The theory was called the epidemiological transition, in which death would only occur in the future by chronic diseases like cancer, cardiovascular disease, diabetes, or by accident, trauma, war, old age. This period, the U.S. Surgeon General himself wrote, "It's time to close the book on infectious diseases." And indeed, the Yale School of Medicine shut down its Department of Infectious Diseases. The Nobel laureate, Frank McLean Burnett, said that there was going to be no more infectious disease in the human future. And my own colleague at the Yale Medical School told the students in my class in 2010, I'll stress the recent nature of it, that my students were wasting their time because infectious diseases don't exist anymore, he said. In any case, the argument I want to make today is that infectious diseases, alas, are part of the human condition because we're immersed in an environment of vast numbers of potentially lethal and ever-evolving microbial species. What has changed is not our vulnerability itself, but the families of pathogens that we encounter and that can thrive in our midst. They reflect conditions that we as ourselves have created. So, as I want to show, the answer to our original question is that COVID reached Lombardy as a result of mature globalization. So that leads me to want to talk for a moment about what dimensions of globalization I have in mind. I have in mind immense population growth or overpopulation in a world that's careening forward to 12 billion people, an infinite expansion on a planet with finite resources. Deforestation, rampant urbanization, agribusiness, these features have exponentially multiplied the contacts between wild animals and humans, both directly and indirectly with domestic or farm animals as intermediate hosts. Most important, contacts have multiplied with species that are reservoirs of microbes that humans have rarely or even sometimes never encountered, and to which we as a species have no immunity. Bats and wildfowl have been especially important, and as we have learned to our cost, many of these previously unknown pathogens not only spill over across the species barrier, but are also able to transmit from person to person highly effectively. So the result, I would say, is that we live in an age of ever more numerous emerging zoonotic diseases. I mean diseases that originate among animals and spill over into our own species. Those diseases, by now, fill the alphabet from A, let's say, avian flu, to Z, Zika. And they include names, sinister ones, Ebola, Lyme disease, HIV/AIDS, MERS, Marburg fever. So in quick synthesis, we can say that's the story that we saw in SARS before COVID. And it's the story of the emergence also of COVID at Wuhan in late 2019. Now, after the epidemic burst out in Wuhan, 4 additional aspects of globalization are critical to what happened in Lombardy. One is the mass rapid movement. Surely this is characteristic of globalization and its very concept. The movement by jet airplane of people, goods, and investments around the earth. Again, population growth. And then I want to talk about also lethal air quality. And with a bit of a stretch, I want to claim that I also think that one of the pathologies of globalization is also populist political priorities. Now, the next slide is, I want to introduce a real link between Lombardy, whoops, I may not get there. So far it's good. Between Lombardy and China, this is a picture of the 2 presidents, Sergio Mattarella of Italy and Xi Jinping, of course, at Beijing in February 2017. What they were meeting to discuss was a bilateral memorandum of agreement that was signed in 2019, which created what some have called a 21st century Silk Road, stretching from Milan to China. The links were to be economic, diplomatic, cultural, financial, and political. China's interest was part of they were part of its Road and Belt Plan, which was going to establish China's influence around the world as it modernized at home its infrastructure, overcame China's isolation abroad, and transitioned to a green economy. So the Chinese wanted to gain access to Milanese design, technology, research, and managerial expertise, and to break the isolation between China and the Western world. The Italian interest was to gain access to burgeoning Chinese consumer demand, access to vast pools of unskilled workers in the Chinese labor market. Giuseppe Sala, the mayor of Milan, said that the future of Milan was now to be linked inextricably to exports to China, and on the other side, the attraction of millions of Chinese tourists to visit Milan. He didn't mention also, I think, another element, the undocumented Chinese workers in text toiling away 12 hours a day in textile sweatshops and leather factories for fast fashion. But that lurked in the background and is an important consideration we shouldn't omit. Now, the implementation of the agreement, signed in 2019, was to take place under the aegis of an institution called the China-Italy Foundation. And this would be supported by supplementary bilateral agreements. That is, there were agreements between the two parliaments, agreements between leading political parties, universities, research institutes, individual companies. There were seminars for businessmen on the law in the other country and how best to go about investing there in a safe and productive way. There was language instruction, Chinese in Italy and Italian in China. There were fairs where each country could demonstrate its culture and its wares. There were student exchange programs, internships, engineers and scientists met together, Chinese and Italian, to discuss AI, aerospace, robotics, and sustainable energy. 6 airlines instituted daily flights from Milan's Malpensa Airport and Rome's Fiumicino to Beijing, Shanghai, Nanking, and a couple of other places. There were weekly rail freight services with 40 flatbeds full with containers of goods made in one country to be sold in the other. There was also a communications channel. It was called Yes Milano, which presented to the Chinese a vision of Milan that was going to attract them rather than to other places in the West. They should come to Milan. Milan, this channel said, was different from the usual tourist trip to Rome, Florence, and Venice. Well, Milan could compete with those places because it also had its own traditional attractions, the Duomo, La Scala, the Brera Academy. But it was also something you wouldn't find, at least according to the Milanese, in anywhere else, here in Rome or in Venice or Florence, and that was modernity. That Milan presented modern architecture, fashion. It had 2 Serie A, or top division soccer teams. It had its wonderful underground system. The results were spectacular. In 2019, 3.5 million Chinese tourists visited Lombardy, and on average, they spent 1,500 euros apiece. 2020 was therefore declared the China-Italian lire year of culture and tourism, and the goal was to attract 6 million Chinese visitors. As we know, that didn't happen. Another feature was that there were Chinatowns. We mustn't forget that. Milan had a Chinatown of 30,000 people. Brescia had over 10,000, Bergamo something similar, and many of these people, this is important from our epidemiological perspective, went back and forth as expatriates to their native country, particularly in time for the Chinese Lunar New Year. So China and Lombardy were deeply linked. And the irony then that I would say is that the arrival of COVID in Lombardy was the opposite of the common view, that COVID broke out in Lombardy not despite its wealth, but because of it. Now, so if that's the first factor, I then want to turn to my second feature of globalization, which is population demography. And this is relevant also to Lombardy and COVID-19. In other words, economic links and mass travel enabled the virus, that is SARS-CoV-2, as it was called, it enabled that virus to reach Milan from Wuhan. But the next issue is to explain then not how it reached Lombardy, but why it found there an environment that was so favorable for its transmission. One factor is the absolute size of population. That matters because population size multiplies contacts, transforms land use, sets off a cascade of environmental consequences, urban expansion, traffic, agribusiness, smog. And it's not by chance that Milan was at the center of the COVID epidemic, because Milan is Italy's largest city. I think I have, I feel I ought to prove that. Let's see, sorry, I didn't prove it. I will in my next slide. I also want to talk about not only the absolute size of population, but its density. And a feature here, obviously, the closer people are to one another, the more easily a pulmonary virus will transmit from one person to another who's nearby and inhales droplets and aerosols from someone who's talking, as I am now, or singing, which I don't do, or is also just near to the next person. So that's the feature I wanted to show you, which is that Lombardy is by a large measure more densely populated than any other region in Italy, except for Campania, where matters are a bit distorted because of Naples and its hinterland. But Lombardy, apart from that, is the most densely populated region of all 20 of Italy's regions. Then I wanted to, I promised I'd do this, so I will. Here we go. This is the population density in a number of selected cities that I chose, and I chose two factors, which is that Milan is Italy's second most densely populated city, and also important, though, is that it shows that even by European standards, compared with capital cities in Europe, Milan is really quite densely populated. And that's an important factor when you're talking about a pulmonary virus. Another factor is important related to population, and that's age structure. The age structure of the population of Italy and Lombardy. SARS-CoV-2, as all of you know, has a strong predilection for the elderly, people over 65, for reasons relating to their vulnerability, general frailty, but especially an accumulation of pre-existing conditions, diabetes, hypertension, cardiovascular disease, and also the elderly have large numbers of immunosuppressed people as a result of chemotherapy for cancer and other conditions. So there is a paradox here, because the very success of the Italian health system was the graying of the population, that Italy had the second oldest population in the world when COVID arrived. In Italy, longevity was 83.3 years of age, the second in the world after only Japan. And in the region of Lombardy, there were some 2,302,000 people over 65. That is 22.8% of the population of Lombardy. And contrast that with the United States, where only 15% of the population reaches that age. So one of the paradoxes then is that the very healthcare success of Italy helped to prepare the way for a pandemic disease. Another feature of Italian and Lombard population is the structure of the family. Italy stands out for its high percent of multi-generational families, of people particularly in the 18 to 34 age cohort. On average, in the European Union, 48% of people aged 18 to 34 live with their parents. In Italy, the corresponding percent is 66. And the result of that is to elevate the transmission of a pulmonary disease clearly from children and young adults to more vulnerable parents and grandparents. And then there's another factor, which is nursing homes. Across the West, nursing homes were a major driver of COVID-19. Congregate living conditions make it impossible for the elderly living in them to socially distance or follow any of the other recommendations for protecting themselves from COVID. There are also poor conditions resulting from most of these places are run for profit, and many of them, there were many scandals in the United States, in Italy, and France, and Spain, in the nursing homes. There were scandalous conditions, poor sanitation and ventilation, no preparedness plans at all, staff without PPE, and no protocols for dealing with an infectious disease, inadequate numbers of staff, and insufficiently trained caretakers. And in Lombardy, Lombardy had fully 20% of all of Italy's nursing home population, some 24,000 people. So, one of the factors is that unregulated, all of these features were working against Lombardy as it was facing this new terrible feature. Then I want to talk about another factor, which has to do with air pollution. And this was absolutely critical to what happened in Lombardy and elsewhere. Air pollution is critical because Lombardy is in the heart of the Po Valley. It's the Po Valley, the Great Plain, Italy's largest plain by far, in the north, is the heart of Italian industry, commercialized agriculture, urban growth, and a dense network of roads. Unregulated, all of those activities belch forth continually fine particulate matter and toxic greenhouse gases, ozone, sulfur dioxide, nitrogen dioxide, carbon dioxide. Particulate matter refers to PM 2.5, as it's called, which represents particles that are about equal to or smaller than 3% of the diameter of a human hair. So these are microscopic particles, are tremendously small. Their sources, fires, the combustion of fossil fuel, building construction and demolition, dust from unpaved roads, industrial processes, the deterioration of tires, all of these, domestic heating, propel particles into the air. And once in the air and then breathed in, they do injury to the lungs. They're a great vulnerability for respiratory viruses subsequently. Because of their microscopic size, they're able, when inhaled, to reach the lowest depths of the respiratory tree, the bronchioles and alveoli, where the gaseous exchange of oxygen and CO2 between the lungs and the bloodstream occurs. There they cause cumulative and irreversible injury and inflammation. Then there are greenhouse gases. Their sources are different. Road traffic, asphalt, refineries, power plants, nitrogen-rich fertilization. In other words, agriculture is also an enormous part of this picture. And there's lots of evidence for the severe smog pollution in Lombardy and throughout the Po Valley. It comes from mapping. Epidemiologists mapped the hot spots for COVID-19 transmission and mapped them onto areas of high atmospheric pollution and found really robust evidence of a correlation. In addition, the European Union carried out a survey of 66 administrative districts across the continent. The result identified 5 that had the worst smog of all. 4 of those were located in the Po Valley, and 1, it won't surprise you, was Lombardy. So in the Po Valley, topography, it's often said by infectious disease specialties, location, 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 and Lombardy's location was crucial. It was in the middle of Italy's large plain, the Po Valley, which runs 650 kilometers from the Alpine foothills in the west to the Adriatic in the east. The Po Valley takes the shape, relevant for us, of an enormous bowl surrounded by mountains that prevent prevailing winds for long periods from clearing the air. And this is dramatically shown in the next slide. You can see this is the Po Valley, and that's a NASA satellite image of pollution that is just stationary. It's motionless over the Po Valley for long periods, and you can't see Lombardy there, I can assure you, but you know it's underneath those poisonous gases and particles above. It's an immense stationary black cloud hovering over the valley that you're looking at. But there's also a special and dreadful feature that occurs periodically, and that's the occurrence of downdrafts. Winds, in other words, that drive pollution low to the ground, maximizing the impact on the health of the population below. And unfortunately, bad things often, this is a perfect storm, which is to say that it was of great misfortune that this downdraft in the critical months of January and February took place as the pandemic was gathering pace. A persistent downdraft that was so hazardous with smog that the local press pronounced the air absolutely unbreathable. Pollution levels reached double the allowable maximum, and an emergency was declared. SARS-CoV-2, had it been sentient, however, would have been happy. This was perfect. An already elderly population was already coughing and choking from smog, forming a perfect target for a virus whose leading presenting system was acute respiratory distress. And this was even worse because many elderly Lombards were or had been dedicated smokers, and the damage to the lungs is cumulative. If you smoke, it increases the injury given by the environmental insult as well. And as I said, it's irreversible. A fourth and fatal factor that I want to talk about related to globalization, as I hinted, was less orthodox. And that is that the healthcare politics of the right-wing populist movements that won power in the region of Lombardy began with this man, Roberto Formigone, who was elected governor of Lombardy in 1995. Remember that the Italian Constitution created a measure of regional decentralization, and so regions have their governors, and in the healthcare system also follows that same pattern. The Article 32 of the Italian Constitution of 1948 specifies that throughout Italy, every citizen is entitled to free health care as a human right, is specified by Article 32. But this is something that is left for implementation to the various regions. And Lombardy elected Roberto Formigone. He was governor of Lombardy since his election in 1995, and held the position continually until 2013, when he was succeeded by two successors of the same right-wing populist and demagogic persuasion, Roberto Maroni and Attilio Fontana. Fontana was actually in office through the whole of the Italian experience of the pandemic. So my somewhat unorthodox view is that globalization as we know it, in the form of unregulated, ever more unequal, and rapacious capitalism, gives rise as well to political as well as medical pathologies, and that the latter have fundamental impacts not only on politics, but also on health. Formigoni, Maroni, and Fontana, the three governors relevant to COVID-19, remind us, perhaps, of other world leaders that you know. Demagogic, charismatic strongmen who promote measures at odds with the constitution of their country, who are staunchly nationalistic and anti-immigrant, and radically underestimated the danger of the pandemic threat. Formigoni, also, like someone you also know, was convicted of fraud and corruption in the form of kickbacks that consisted, I guess, a little like Clarence Thomas. He had some 75 million euros in kickbacks, and he also had 6 million euros that were given to him in the form of travel to exotic islands, restaurants, and all the rest. And the money came from lobbyists who were wanting to support what I want to talk about next, which is that this wasn't just a political change, it also was fundamental and fatal to the Italian experience of COVID-19. That is, Formigoni launched in 1997 what he called a reform program, which was to starve the beast, a term we might also know, that it was the Lombard model of health. The idea was that he would introduce privatization. He was very influenced by Margaret Thatcher and her program of privatizing the National Health Service, and he thought that Lombardy could do exactly the same, with results that would enormously increase profits, enable the possibility of reducing taxes, and he claimed that it would also make it would devalue, there was the ideology, it would be good for patient choice. There wouldn't be long lines. There would be a free market. And this went with it. There would be cost reductions. And so one of Formigoni's part of the program was to slash the budget for healthcare and for scientific research. He wasn't really a great fan of bench science. In addition, what went with this was a program that was to turn from certain, that is, community health, which was built on family doctors and general practitioners. These were considered no longer necessary, partly because Formigoni held that view still that infectious diseases are something of the past. We don't have to worry about them like someone nearer and dearer to us. It's not really very serious. It's not much worse than a flu. He therefore fundamentally underestimated it, but in addition, he wanted to concentrate health in large hospital centers where there would be remunerative specialties, that is, cardiovascular care and oncology. Those make lots of money, and it's people pushing those interests who were paying him the money that he was actually finally sent to prison for. By the way, he's still under house arrest as we're speaking. The results of this, then, were pretty awful in lots of ways. One was that the Lombardy found itself flying blind through an epidemic storm when it appeared. The reason was that it had cut itself off from the people who are the sentinels, the eyes and ears of the public health service, that is, local physicians at community health centers, family practitioners, and when they protested already in January of 2020 that there was this strange feature of the appearance of what they called an atypical pneumonia, but one that didn't respond to any known treatment, they were astounded. The state closed its ears. This wasn't taken account of, and they were considered dinosaurs making Cassandra-like noises that had nothing to do with reality. So as a result, what happened was that the disease was enabled to carry on for some time without being noticed in Lombardy, and to a lesser extent in a little bit in the Veneto and other Po Valley regions. And this had an enormous effect because the way as South Korea demonstrated, and as the Veneto region right next door to Lombardy demonstrated, the best way on public health measures for an unknown disease for which there's no vaccine, no prevention, and no cure, there are still traditional measures you can take which center around testing, contact tracing, and isolation of people who test positive. This couldn't be done in Lombardy and wasn't done, and the result was that the disease was proliferating, and this particular disease is highly infectious, so it's estimated that about one single patient is likely to infect. This is called the R0 number in lots, if you like, your medical modeling. It's about over 3, which is to say that every person who has COVID-19 is likely on average to infect 3 other people. So if you imagine 3 times 3 times 3 times 3, you have an explosive event. If you had intervened earlier, as South Korea did and the Veneto did, the results, you at least have a chance of containing the disease at a low level. That chance was lost, or shall we say, as Dr. Tedros of the WHO said, the Director General, that what was wasted was a window of opportunity that they had in order to deal with this in a more scientific way. Well, there were other results, but first I want to, I'm running out of time. I promise not to go over. So I want to also say now, I'm not going into the disease, you'll be glad to know, because that would take me the next hour. But at least I can say that we've reached the point where it's starting. And so I thought, like the epidemic itself, I ought to at least light the match and say there was an event that did just that. And we'd had a super spreader event. In many countries, there has been such an event, which is like a trigger that detonates a bomb or an explosion. And this occurred at this place. I imagine not many of you have been there, but it's the famous San Siro stadium in Milan. It's Italy's largest soccer stadium. And I knew you would be interested in this. On the 19th of February 2020, there was a Super League championship game between the Spanish team Valencia and an Italian team, Atalanta from Bergamo. Now, poor Atalanta was, it was David versus Goliath, and it was the David. Valencia was this wonderful team. Atalanta had never won anything to speak of, and this was the greatest game, the greatest heights it had ever reached as a team. And so to see that event, 40,000 people from Bergamo came to Milan and sat in the stands with fans from all over Italy. And there they crowded onto crowded trains. It's 30 miles away. When they got to Milan, they waited at the turnstiles in a crowd. Then they went in and they started huddled together. They sang songs. We've just talked about aerosols and droplets. They were singing their heads off. And this was an enormous event. Then, well, I know you're waiting for the punchline, and that is Atalanta won. You'll be glad to know that, 4-1. All of you were waiting in suspense. Well, the trouble there is that was actually great news for soccer fans if you're Italian, but terrible for public health. Because what happened then was that people poured out of the stadiums and they couldn't believe that David had won. And so they caroused late into the night in pubs, restaurants, bars. Then early in the morning, they clambered back onto trains and buses and went back to Bergamo. Now, the pulmonary pathologist, the lead pathologist at Bergamo's famous hospital, the Pope John the 23rd Hospital, said that this soccer game was a biological bomb that detonated with the match at the San Siro. Well, I would talk more, but if I said anything more, we'd move into the epidemic itself. So I'll stop right there. And if anyone wants to talk about anything, I was kind of thinking about maybe what lessons there might be or something like that, but I leave that all to you.
Powerful and thought-provoking lecture. And are you willing to take some questions?
Oh, of course, yes.
Great, questions.
Always, if anyone has them, and if not, we can all go to dinner, and so nothing lost. Oh, yes.
Right, well, the daily flights coming from Wuhan into Milano, a series of flights for workers entering into the labor force here. Was that ongoing throughout this period also?
Well, not after February 2020, but up till then it was, yes. So that's how the disease reached this country. But that portal, if you like, was closed when it exploded into an epidemic.
Thanks so much for that very compelling and chilling lecture. I think we're not the only one who feels that way. I was noticing when you were presenting and discussing on the Lombardy health model, just so many similarities to the way the hospital systems have been changing in New York City in particular, with the closure of community hospitals. I think Beth Israel is supposed to close soon as well, even though it was an important source for beds during the pandemic. And I just wonder, do you think the conditions in Lombardy were also similar or analogous in some ways to those in New York, and also just your reflections on the shortness of a sort of attention span, if it's not in spite of Lombardy's wealth, but because of it, sort of, what direction do you think sort of public health should be, sort of, at what level do you think public health should be addressing these sorts of things.
Right. Actually, you cheated. There's more than one question there. But no, I'm really delighted that you did, and those are interesting, really important questions. With regard to, I guess, even a prior question is, why did I talk about the health system in Lombardy? It's because I think that it has a flashing red light for the rest of the world to think about. What happens when healthcare becomes a commodity and no longer a human right? And what happens when you build health centers that are distant from people because they're in huge medical centers, and you don't have community health centers, and you begin to have a world in which there are relatively few, they call them, well, never mind what they call them. The point is that they're family physicians and general practitioners, and I think that's really critical to healthcare, is that relationship, and that's what was broken in the Lombard system. And it went further than that because it was the truth that Italian medical students no longer went into specialties like infectious diseases. They went instead, and in fact it was harder because they weren't given the same funding to study infectious diseases as they were if they went into gastroenterology or cardiology, pulmonary specialties, and so on. And so Italy was getting ever less, and it was defunding its hospitals so that it was squeezing out any surge capacity that it used to have. And I hope I'll get this statistic right, but comparing Italy with Germany, Germany at the time had a population of 80 million people, and it had 20,000 ICU units. Lombardy, with its population of 60 million, had 5,000 ICU units. And those, the staff didn't have PPE. There were no beds left. They'd squeezed all the surge out of it. There were no protocols for preparedness. They had forgotten that, in fact, here we have hubris, which is another quality of some of these movements, and they thought they knew. What did they know? They knew that epidemic diseases aren't a problem, and certainly not in Lombardy or New York. We're above that kind of thing. I think was what we faced. We had political leaders telling us that. So I think it's a terrible feature, but a major lesson from this pandemic. And your last point about what should be done in this situation, and that's a really big question, and I didn't try to even attack it because you can't really do that just from one region in the world like this. You need to make international comparisons, but looking back, we don't have to close our eyes. There are certain things that are really clear. One is that we need sentinels. Lombardy needed sentinels. They need to be posted, and they take many forms. There are those family physicians, community health centers. Those are critical, but also this looking further afield, and we learned this from China, which is you really need sentinels at the border between animals with reservoirs of very dangerous pathogens and human beings, and there needs to be testing regularly at that interface, and that's something that also wasn't done. And here we can quote Anthony Fauci from 2005. He went to the US Congress and he said, preparedness is vital for infectious diseases. He said, I can tell you for a fact, if I were a meteorologist, I would tell you if you live in the Caribbean, you're going to have a terrible storm one day. And I can't tell you how strong it will be or the date of its arrival, but I can tell you you're very unwise if you don't prepare for it. He said that's exactly the same with regard to infectious diseases. We live in an era of pulmonary viruses, and the next one is waiting to strike. And if we don't prepare for it, it will be flying in a hurricane for which will be flying blind, as Lombardy was at the start of 2020. So I think that's a very important factor. It would also be nice if we could have politicians who knew something about basic science. would be another thing that I would recommend.
May I ask a question from Zoom? This question is from Stephanie Malia Hom. Thank you for the wonderful lecture. Could you please comment on the rise of the infodemic alongside the pandemic in Italy and how the circulation of mis- and disinformation impacted the spread of COVID-19?
Oh, a really big question that I'll cheat and say that this is probably more visible and more detrimental outside of Italy than it did. It did more damage in the United States, for example, than I think that it did in Italy. In fact, there were some, Dr. Tedros of the WHO again said that there were two pandemics. One was the pandemic of the disease, and the other was the pandemic of misinformation through social media and other sources. And that had really terrible effects on the ability of messaging from health authorities suggesting ways that people can help themselves, whether by vaccinating or before that, social distancing, wearing masks. And in the States, we see culture wars over masking, where it's a symbol of masculinity to not put on a mask. You're somehow, I don't know why, people are willing to wear motorcycle helmets, and that's manly, as so is body armor, seems to be manly too. But putting a mask on somehow does something to your manliness. I don't quite know what that is or why that is, and maybe someone can explain that. I really can't yet. So I'm puzzled. But I do think that those are really, the messaging was really critical. And we can see that because it doesn't end. It went down through the period when there was a vaccine. And there was so much worry about whether if you're pregnant, this is going to have terrible consequences. If you'll get autism, all these kinds of things were said, and people did believe in large numbers, and that reduced the capacity of everyone to be able to lower the threshold of this disease. And so it had consequences on the national health and also global health throughout the world. In Italy, I'm out of my depth. I don't follow Italian social media, or American for that matter, but I confess. But the point is, I think that looking at the results and what commentators say, it seems to me that there was more of a side, at least especially in this first wave in the beginning, where social media was used to support the message of the state, where Italians said, we're all in this together. I remember myself, I was here, and I had COVID, so I made a little contribution to the Italian figures. But in addition, I got to hear outside the supermarket when people were socially distanced, they were still talking, and they would say things such as, this is really what it must have been like in London during the Blitz, and we're all in it together, they said, and people sang on their balconies, and there were groups, chat groups, who supported each other, and there were toasts via social media. And it's sort of moving that all the political parties supported the lockdown, and the church did the same. The Bishop of Milan, blessed the city and all that. And so it was quite a different, now this begins to split asunder with subsequent waves in Italy, and you get more resistance and pushback. But America started out in a really fragmented way and continued that way. Italy started out in a more collective sense, but went in a downward direction also, would be the way I think of it.
Zach?
Yeah. I think you touched on it a little bit, but I wanted you to speak to the strength of the voice of like an or external authority like the WHO in that late 19.
Right. I think we're there. I believe that the WHO is absolutely critical, in part because we have nothing else. If we're going to have no other authority exists that would be possibly trusted around the world and people would agree to cooperate with. So I'm a great believer in it and think that it's critical to our future and our preparedness. But that doesn't mean that I think that everything the WHO did was wise and wonderful. And I do think that the way they greeted the Chinese actions early and said this was a model and we'd all be grateful to the Chinese for the way that they were handling COVID. And that's disguising the fact that the Chinese also did something terrible, which is even to today, it's impossible to do proper epidemiology and be certain about how the disease began because the authorities won't give access to outside experts to any of that data and material. So the debate about how it actually began, which would be very useful for epidemiologists, it really, one has assumptions and there's some indications, but it's not definitive, and that's a really sad thing. And I'm sorry that the World Health Organization didn't talk about the absolute need for transparency at the beginning of the epidemic. And the Chinese, I'm not here to attack the Chinese. I just want to say what they did at the start of the epidemic was not constructive in that way, and I don't think is a model of good public health. You can't do public health in the dark. Public health is a matter of absolute truth, openness, and transparency.
Question in the back?
Yeah, I guess mine's two parts. One, the corrupt governor that instituted the Lombardy system, did that over the course from 1997 to the breakout, did it reduce the number of hospital beds per the population? And then, if so, has there been any kind of government movement towards mandating X number of beds per 10,000?
Well, I'd be interested in what you think about human nature. It seems to me that human beings, once a danger is past, often like to put it behind them. And I think there was a time during the epidemic when there was a possibility of persuading statesmen that funds for preparedness, or just as you're saying, are really essential. I think that's passed on both sides of the Atlantic and throughout Europe as well. And so I'm worried about the very point that you're saying. I don't think that funds are being allocated in the way that you're indicating to have surge capacity, to restore community health centers, to fund the education of primary care physicians. Those are things that aren't being done. And the Lombardy model, unfortunately, is also, it's metastasizing in the Italian health system. And so it's not the only region that's trending in that direction.
Why don't we take one more question?
My question was also about the policy impacts of what happened in 2020, and you answered a whole bunch of them already. That, for example, there's not a push towards re-incentivizing community medicine, but I was wondering about if, for example, the local reporting of diseases. Has there been any kind of policy movement in that sense? What are there any positive policy impacts? Because you seem to. It sounds like there's not.
Oh dear. I have a group of people that I Zoom with once a week, old friends from school days, and I've gained the reputation of being Dr. Gloom, is how they refer to me. So you're dead right. I don't have good news to report to you on that front. It doesn't seem that there is a movement to revive community health centers. There isn't any of those things that I think are very important, or to recognize health as a human right. Now that's not my idea, that's something where the WHO is very strongly pressing that all over the world, and I don't know why so many ears are tone deaf to that particular bit of advice that seems absolutely crucial. And also this fragmentation between state and state. In the EU couldn't actually have a coherent plan. And so it's fragmented all over the world, and there is no kind of unitary sense. And the one thing I would report back from a conference I went to the WHO not so long ago, and there were delegates from all over the world, and there was a great rage among Indian and African delegates about American policy with regard to vaccines, and the sense that this is part of the world's fragmentation, and this is exactly, and it's amazing to think in a pandemic that you can protect yourself in a single country as if viruses also have little flags and passports, and, and stop at a border. That doesn't happen, and so it was really every case is also an opportunity for mutations and new variants to emerge. And so it was a very, I think, very sad policy to regard profit and therefore that is intellectual property as taking precedence over human life. And delegates from around the world, I imagine not just delegates, but people all over the world have seen that, and hopefully that will never repeat itself, but I'm not a tremendous optimist.
Well, on that note, thank you very much, and we can continue the conversation.
Thank you.
Happy Georgia.